My name is Krystyn Vaughan, and I'm a family nurse practitioner student at Arkansas State. The title of my presentation is Comparison of Bone Density Screening Rates Among Medicare Women at a Rural Arkansas Clinic Against the National Average. My faculty mentor for this project is Dr. Mark Foster. Osteoporosis is projected to impact nearly 14 million people by the year of 2020, most notably women over the age of 65. When we look at this on a more local level, by the year of 2030, around 66% of the population in Arkansas will be affected as well. One of the biggest concerns with osteoporosis is that it's typically referred to as a silent bone disease because so many patients don't realize that they have low bone density until they've already suffered a fragility fracture. These fractures can cause loss of independence, extensive rehab, financial burdens, and even mortality. The U.S. Preventative Services Task Force recommends that all women 65 and older receive osteoporosis screening via bone density measures. Now, Medicare covers bone density screenings every 2 years for women 65 and older, yet the CDC maintains that 40% of Medicare women report never receiving a bone density scan. In fact, in Arkansas alone, there's been a 16.8% decline in DEXA screenings and an additional 700 preventable hip fractures since the year of 2008. So the purpose of this study was to compare the rate of bone density scans in Medicare women 65 and older at a rural Arkansas clinic against the national surveyed average of 60%. This study was designed as a descriptive retrospective chart review with a randomized convenience sample of 50 charts that were collected from a family practice clinic in rural northeastern Arkansas. The study population included females aged 65 and older with primary insurance coverage through Medicare. Of the 50 charts reviewed in this study, there were 24 with documentation to support receiving a bone density scan, meaning that this rural clinic had an average screening rate of 48% when compared to the national average of 60%. The data was broken down into 6 age cohorts just to see if there were certain groups that were maybe receiving screenings more frequently than others. And the data actually suggested that those of younger ages were more likely to receive screenings because between the ages of 65 and 79, more than half of the participants actually received a scan. The most critical gap in the age groups were those that were 80 years and older, as they received screenings at a much lower rate. This is actually consistent with the literature on bone density screening, which states that older age is a negative predictor of receiving a scan. There were 2 notable limitations to this study, with the first being the relatively small sample size of 50 charts when compared to the 3,500 sample size from the national survey. And then the second limitation was the lack of diversity in this study. This study had 48 Caucasian females and 2 African American females, whereas the comparative study had a much more diverse population. So, because this rural clinic sits below the national average, it stands to reason that there have to be some practical interventions that could be implemented to better promote more frequent and consistent bone density scans at the local level. More inclusive preventative health protocols and better prompting in the electronic charting system could help providers and the staff stay more aware of which patients have not received screenings and which ones are due for screenings again. And then because the nursing staff is responsible for the preventative health screenings and referrals in this clinic, staff-wide education on the policies and protocols that go along with bone density scans may help foster a team-based effort to complete them in a more timely manner. In rural areas, clinics like this one in this study function with mainly APRNs as the primary providers. So it's crucial that APRNs understand and incorporate and advocate for the proper bone health and osteoporosis screenings in their routine preventative services. I hope the findings of this study help promote better patient outcomes, higher quality of life, and longer functional independence for their aging patient populations. Thank you all so much for watching and listening, and I hope you've enjoyed this presentation.